Hello, this is Nurse Choma, founder of Choosing Nursing, and in this video, I'm going to be talking with you about what are some uncommon signs that a patient is declining. So whether you are a nursing student, RN, LVN, or maybe you are even aspiring medical student or you're getting ready to go into your residency, you may want to find this video helpful. So go ahead, stay tuned and watch this video to the very end, and I'm going to talk. Hi, all right, well, welcome back. So in this video, I'm going to be talking with you about what are some uncommon signs that your patient is going down the tubes or they're beginning to decline, so that way you know exactly what you should do, or what you should begin to do, or what you should be thinking about. And this is relevant whether you are in an acute care setting, or if you're in a setting like a sniff. You do have to be able to recognize if something's going on acutely with the patient, so that way they can be sent out to a hospital, right? Or like a someone that's more acute care like setting, right? So let's talk about what are some uncommon signs that you need to pay attention to. The first one, number one, is going to be change in level of consciousness. All right, change in level of consciousness. So the baseline for everybody when you are in your right frame of mind, and there could be different reasons why a patient level of consciousness would change, but we call it being alert and oriented times four, right? Alert and oriented times four. You can put that in the comments. So ANO times four. So that means that they are aware of who they are, right? So you ask them who they are, they can tell you their name. They know where they're at. They know what time it is, or time, day of the week, year, and they know the event. Like they know what's going on. Like, oh, you're in the hospital. Like they're aware of all these things times four. So anytime they're not able to tell you one of those four elements, it means that they are, like, whether it's only they can only tell you who they are, but they can't tell you all the other three. Then they're alert times one, right? Or they tell you that they know who they are and they only know what today is and that's it. Then they're alert times two. So you, at the beginning of your shift and then also throughout care, you should be asking them, can you tell me what your name is? Can you tell me where you are? Can you tell me what's going on? Especially if there's potential indications that they would have that they would be confused. So, for example, if maybe they're acutely ill, they're having worsening signs and symptoms, they are going to respiratory failure, organ failure, like, and it's not just anything that extreme. They're septic, they have pneumonia, COVID, whatever it may be. You ask them these questions either way to determine their orientation status. And if throughout your shift, throughout the time of taking care of them, they now are not able, they are showing signs that they're confused, like they're wandering, or if they're able to walk, um, they're just showing signs of confusion, then that's your opportunity to reassess and ask them again, hey, do you know where you're at right now? Do you know what day it is? Right. And so then at that point, they may give you a different answer than before. So a change in the level of consciousness, it could also, depending on the pathophysiology that's causing them to be confused, it can be oxygenation issue. It can also be just some type of issue going on as far as like in their brain anatomy. Like there could be so many different things going on. If they are, possibly having like a stroke or something, then you also look for other signs such as their face, like drooping, etc. So there's different things, right? There's different reasons why their consciousness could change. And then also commonly we see this with elderly patients too that get confused. And sometimes it could be, if it's sudden, out of nowhere, right? We call it delirium instead. But if it's a chronic problem, then we call it dementia. Another thing, number two, is change in urinary or elimination output. Usually urinary, but it could also be elimination as far as, and it could be something, it would have to be pretty extreme. So change in urinary output, this will look like they are peeing less, right? Whether they're drinking a lot of fluids or getting a lot of fluids, but they're not producing, it's not coming out of their body, the amount that we're putting in, then there's a problem with what? Kidney function, right? So they're not producing enough urine. Another thing too is if the change in the elimination output could be that the change in their stool color, right? So let me know in the comments if their stool is black, what does that mean? Right? What does that mean? If their stool, it's coming out like a black color, what does that indicate? It indicates that they likely have an upper GI bleed, right? So there's something going on with the patient where there's some type of upper bleed, right? So this is so that would also be a sign that they're declining as well because they're bleeding inside, right? And we're just catching on, right? So essentially, the blood could be going up, could be is occurring somewhere in the upper GI system, or the I should see that whatever is causing them to bleed inside. And as a result, that blood dries up, and by the time it passes, it's already black. And so that's why it's black in nature. Another thing too is just a change in their baseline, right? So you have to pay attention. What is their baseline? What is the baseline of the patient, right? So what were they like before they got to the hospital, before they fell, before they were sick, or whatever that is? Is there a difference in their baseline? That's why you have to ask. If they're in their right frame of mind, you ask them, or you can ask their family or friends. And so typically family. And so then we can identify, okay, this is different from where they normally are. And so that is also indication that they're declining. Another sign as well that the patient is getting worse is their change in their heart rate. All right. So usually if the heart rate is actually increasing or if it's getting worse as well. So if it's going up, then that could be a sign that the heart rate is going up. All right. That could be a sign that something's going wrong with the patient. So if their heart rate is increasing, um, and like I said, there's tachycardia can have a number of different causes. And you also want to look at the heart rate along with their blood pressure as well. But sometimes the increased heart rate could indicate that the heart is working harder. So it's trying to compensate and it's working a lot more harder. And as a result, that's why it's beating faster because it's trying to get more cardiac output more. Like, so there, for whatever reason, usually there's a decrease in cardiac output, so not enough blood perfusion is actually getting through, and so as a result, the heart's trying to compensate by beating faster, right, in order to push out more blood flow, more blood through. So increased heart rate could also be a sign that they're declining, and like sometimes these are very subtle signs. Like you may be seeing this and like, oh, that's so obvious, like duh, yeah. But when you're actually seeing it in the practical world, or you're seeing it on a question or whatever, it's really easily ignored. It's not something like it's not something you will always critically think unless it's like dramatically increased, like 140 or something, right? 150. So now we're getting into um, you know um, SVT, like really higher heart rate rhythms, right? But what about if it's like 119 or 125, right? So these are so like so the heart, like I said, once again, it's working faster. So and usually, so a lot of times, what we'll do, depending if the patient, unless it's contraindicated, then we will put them on fluids because in order to help. But because sometimes it may indicate that they may be dehydrated. Like I said, it all depends on what the diagnosis of the patient is. Okay, so then another thing too as well, and if you find this helpful, go ahead right now and like the video and thumbs up, comment below what you're finding helpful from this particular video. Another thing as well is changes in their skin color. Okay, changes in their skin color. Now, this one usually it's not a like it doesn't usually happen. Well, let me say it like this. I was like, it doesn't usually happen fast, like quickly, but it could vary. So, and there's different sudden, gradual, or immediate changes that we could possibly see. So, one, they change. They're more pale, right? So their face looks more pale. Another change could be they look blue, literally, right? So that would be very urgent. That would be an emergency. Another could as well, and this usually happens before, not like once they're already before they get to the hospital, but they could be yellow, right? Yellowing of the eyes, the skin looks yellow, and usually that is an indication of some type of liver failure or acute liver failure that's going on with them. So changes in their skin color too, that does matter, right? And once again, we don't want to figure out what their baseline is as well. But that could be huge as well. You could go into the room, they're all fine, and then an hour later, or 30 minutes later, you come back, and now you notice their skin color, they look more pale, right? And if it's also being combined with other vitals, because the body leaves clues. Okay, the body leaves clues. So if it's being combined with other vitals, so for example, let's say you see they're really really pale, then you want to go and take that blood pressure really quick, get a full set of vitals, ask them if they know where they're at, look at their O2 saturation, right? So so you can now begin to do some detective work and figure out, okay, what does all of this mean, right? What's really going on with my patient? So these are some of the different. Not that all these things can happen at the same time, because they don't usually always happen at the same time. Some of them can happen together, some of them don't. They can be independent of each other. And so that's why I want to give you each of them, so that way you have an idea and you can begin to think about what you need to know, so that you can recognize that your patient is actually declining. All right. So if you found this helpful, go ahead, like I said, comment below. Let me know you found it helpful. If you want to get more information, if you want to learn more, you can make sure that you go ahead and join our email list, right? So you can I can see, look at the description below this video, and that's how you can join our nursing email list. If you want to be a part of our 6-week NCLEX review class, it's an online review class where I'm going to be teaching you and showing you how to, pass your 6-week exam, whether it's myself or one of our instructors. If you want to be a part of this upcoming review class, then also you can press below and look at the description below this video in order to join. All right. So you can look below. I'll put it right here in the comments as well. Okay, and you can check the description in order to join our 6-week review class. All right, we're going to be starting soon. Don't want you to miss out on it. And it's not something we have all the time. We have it on very specific times and dates of the year. So make sure you check the description below for more information about that. And then go ahead and share this video, like the video, subscribe if you're not already subscribing on our YouTube channel. And I'll see you the next time. Take care.